Now that we've made your AM aligner and it's custom molded to you, we're going to walk through the 3 steps to checking your bite. Step 1 is your AM aligner. That's the clear bite tab that we've molded to fit just to you. Step 2 is checking your bite with your floss. And step 3 is using the blue bite tab. When you go through this process, we want to make sure that your bite returns to normal in the morning due to jaw protrusion. We'll talk about this more in a minute. When wearing a mandibular advancement device, it moves your lower jaw forward all night long. As you can see, the lower jaw is protruded here. What we want is this facial muscle on the side of your jaw to relax and for you to go back to your natural bite in the morning and be retruded. This usually occurs about 15 to 20 minutes after taking your appliance out. Before you do go through the 3-step process that we talked about, make sure that you allow about 10 to 15 minutes before you practice checking your bite. Step 1, trying in your morning aligner. Go ahead and put it between your teeth. Make sure that it fits just like it did when you made it and that your back teeth are touching. For most people, this happens very quickly after that 10 to 15 minute wait period. For other people, they do need to use the little exerciser by tapping up and down about 15 to 20 times. You'll do about 3 repetitions of this, taking the appliance out from between your teeth each time and reinserting it. Step 2, checking your bite with the floss. Take your floss, extend it out, and then fold it into quarters. Folding 1 time, a second time, and then kind of tightening one end so that you have a thicker piece of floss. Now you're ready for step 2. We're going to check our teeth and our bite with the floss now. The goal of the floss is to put it as far back as possible so that your back molars can grab it, upper and lower teeth, and then give that floss a tug. And that means you have great contact. That means your lower jaw has returned to its normal position and your bite is also normal. Now what you do to the right side, you always want to do to the left. Again, give that floss a tug. If you pass this step, you don't have to move to step 3. If for some reason you check with the floss and you're not able to grab it and it comes out to the side, that means you've lost your contact in some way and your teeth aren't coming together. That means your lower jaw is probably still slightly forward. Now we'll move to step 3. Step 3, using your blue bite tab. You'll go to step 3 if your floss was not able to be grabbed by your upper and lower teeth in the back. Go ahead and place your blue bite tab between your upper and lower front teeth. You're gonna bite about halfway through so that you have a good end that you can grab a hold of with your fingers. Make sure now you bite down pretty hard and you're gonna press that tab down and back so that you're applying pressure to push your lower jaw backwards. This process does not feel great, but it should not hurt. You're gonna apply pressure for about 15 to 20 seconds, pushing that lower jaw back and down, release, relax, and then do it again. Just like your clear aligner, you're gonna do this process about 2 to 3 repetitions. Release. Now return to step 1. Use your AM aligner again to check your bite. Tap up and down about 15 to 20 times. Make sure you can feel your back teeth coming together. And then go to your floss. With your floss, make sure your back molars can grab it. If you can give it a tug, you've passed step 2. Now you're finished. If you haven't passed step 2, keep repeating the whole process with the blue bite tab all the way through steps 1 through 3 until you pass step 2. Let's review the process one more time. Checking your morning bite in the morning starts about 15 to 20 minutes after you take the appliance out of your mouth. Use your AM aligner as step 1 to make sure your teeth match up and that your back teeth are touching. Use the exerciser portion by tapping up and down 15 to 20 times. Step 2 is grab the floss between your upper and lower teeth on both your right and left side. Once you grab the floss, you've passed step 2 and you're finished with the process. If you can pull the floss out between your teeth, you're going to move to step 3, which is your blue bite tab. Use the blue bite tab, pushing your lower jaw all the way back, not up, but back and down, and holding 15 to 20 seconds, doing 2 to 3 repetitions. Keep repeating the process until you can grab your floss with your teeth and make good contact. This process just takes a couple of minutes to do, usually when brushing your teeth in the morning, and can be completed very quickly. We do recommend doing this process every day, or else you may lose your bite permanently. Let us know if you have any questions, and we're happy to help. Thanks so much, guys.